Hello, everyone, and welcome to our question lab. We're happy to have you here. Tonight's topic is cardiac physiology, and leading this evening's discussion once again is Dr. Paras Vicaria, and he's going to introduce himself now.
Thank you, Sean. Hey guys, my name is Paras. I am a dermatology resident at UT Southwestern here in Dallas, Texas. I originally graduated from pharmacy school in St. Louis, Missouri, and then went back to Michigan to do medical school. I also work with USMLE-Rx as an Rx coach, so I work one-on-one with students to help prepare them for the USMLE Step 1 and Step 2 CK as well. And I'm happy to help lead tonight's session.
Which of the following sympathetic effects of norepinephrine is correctly paired with its underlying physiologic mechanism? So once again, we'll ask you how many steps you believe this question will require before we move on. So an example of a one-step question could be where they ask you, what is the diagnosis? An example of a two-step question could be where you're asked for the treatment for a diagnosis. And an example of a three-step question could be where you're asked for the mechanism of action for a treatment for a diagnosis. So with that in mind, please let us know in the question box how many steps you believe this question will require. And we'll move on to the vignette. I see the responses coming in, so let's go ahead and read that vignette. A 65-year-old man is admitted with fever and severe hypotension. He is found to have pneumonia of the left lower lobe, which is treated with antibiotics. His low blood pressure is increased with norepinephrine. Which of the following sympathetic effects of norepinephrine is correctly paired with its underlying physiologic mechanism? We want all of you to start thinking about the important clues in the vignette and lead-in as I hand it off to Paras.
Thank you, Sean. So I'm going to go ahead and walk you guys through what we think are the important clues in this vignette and the lead-in. So starting off, demographics. So we have a 65-year-old male here. So anytime you have a question that gives you demographics, usually right off the bat, important to make note of that because that's going to start to clue you in on what things you should be thinking about, okay? Also, it's important to make note of why did they come in to see the doctor? Why are they admitted? Why are they in the ER? In this case, it's fever and severe hypotension. So those were the initial presenting signs and symptoms, okay? Always important to make note of that. They then tell us that this patient has had some workup done, and then they're asking specifically about norepinephrine. So as Sean had mentioned, by reading that lead-in first, we actually kind of knew what this question was really about. Not too much there in the vignette that changed what the question was asking. So we kind of knew that this question was asking about norepinephrine. Specifically, which sympathetic effect of norepinephrine is correctly paired with its underlying physiologic mechanism? So those are the important clues in that lead-in. So in terms of how many steps do we think this question is? Well, I think one, we need to know the sympathetic effects of norepinephrine. And then two, we need to know a little bit more about its physiologic mechanism in order to correctly pair it. So I think this could be a two-step question, knowing two different things that we kind of have to pair together correctly. So let's go ahead and take a look at those answer choices. And as you can see here, we have 5 answer choices. So what we're going to do is we're actually going to start at the bottom and we're going to work our way up to the top. So we recommend students do this as well because, you know, a lot of times we'll work with students and we'll see that they'll start at the top. They'll select something they like and then they'll select that and without having gone through all the answer choices. So doing it this way prevents you from doing that and prevents you from biasing yourself. So we're going to go ahead and do that now. Answer choice E, increased myocyte contractility paired with increased inward calcium current. Answer choice D, increased heart rate paired with increased outward sodium current in the sinoatrial node. C, increased heart rate paired with decreased inward sodium current in the sinoatrial node. B, increased atrioventricular nodal conduction velocity, and that's paired with increased inward sodium current. B, increased atrioventricular nodal conduction velocity, and that is paired with decreased inward calcium current. So a lot of long answer choices here. Make sure you're reading those correctly and seeing how they pair up, because we need to pick the one that is correctly paired. Okay. So we're going to go ahead and open up that poll, and then go ahead and select the one that you think is correct, and we'll talk about it in just a few seconds.
So because their answer choices are a little long here, I'm going to go ahead and read these choices back to you. Answer choice E, increased myocyte contractility and increased inward calcium current. D, increased heart rate and increased outward sodium current in the sinoatrial node. C, increased heart rate and decreased inward sodium current in the sinoatrial node. B, increased atrioventricular nodal conduction velocity, increased inward sodium current, that's B. A is increased atrioventricular nodal conduction velocity and decreased inward calcium current. So I'll give all of you a few moments here to submit your responses. I'll wait until about 2/3 of you have submitted them. Keep in mind that all your responses are always anonymous. And you should never leave a question blank on test day, because there is no penalty for guessing, only points for correct answers. So even if tonight you're unsure, just take your best guess, and I will go over the correct and incorrect answer choices shortly. All right, looks like about 2/3 of you have voted. Let's go ahead and close that poll and see what you selected. Looks like in first place was 41% of you was picking, 41% of you picking was answer choice E, increased myocyte contractility and increased inward calcium current. So let's take a look and see what the correct answer is. And the correct answer is indeed E, and 41% of you got it right, a challenging question. And Boris is going to walk us through it now. Boris.
Thank you, Sean. Yes, definitely a tough question. So you can see these are some of the questions where the answer choices can trick you up. So it's important to really understand what's going on and what they're asking you. So let's take a look at this question. So this patient is specifically, they're talking about norepinephrine, okay? On the next slide, Sean has actually gone ahead and pulled up an important table from first aid talking about sympathomimetics, okay? So we see here that norepinephrine activates a few receptors, alpha-1, alpha-2, and beta-1, okay? Now, specifically talking about beta-1 receptors, it activates that, and through G protein activation, eventually leads to increased CAMP, or CAMP. This then leads to increased calcium influx into the cells, which then causes myocyte contractility to increase, and you're increasing cardiac contractility and thus cardiac output, as you can see there in the very bottom of those hemodynamic changes, increased cardiac output. Furthermore, on the next slide, there's also another table from first aid that talks about what happens to contractility with catecholamine stimulation, and that's in that second row. You can see there that it talks specifically that catecholamine stimulate the beta-1 receptor, and you can see that whole pathway via protein kinase A and how that leads to increased calcium accumulating within the cell. That increased intracellular calcium thus leads to increased contractility, okay? So let's go back and take a look at the answer choices, and hopefully you guys can see why answer choice E now here is now correct, because it does increase inward calcium current, as we mentioned, and that leads to increased myocyte contractility, okay? What about the other answer choices? Well, answer choice D, increased heart rate, is actually due to an increase in the inward sodium current in the SA node, not an outward sodium current. So that would also be incorrect. Answer choice C, increased heart rate, This is caused by an increase in the inward sodium current, not a decrease in the inward sodium current. So that in and of itself is actually incorrect, just like D. Answer choice B, increased AV nodal conduction velocity paired with increased inward sodium current. This actually occurs via calcium channels. So an increase in the inward calcium current increases AV nodal conduction velocity, not sodium current. So answer choice B in and of itself is incorrect. And lastly, answer choice A, this is correct in that it's calcium that's involved in increasing AV nodal conduction velocity, but it's actually an increased inward calcium current, not a decreased. So answer choices A to D are actually physiologically incorrect. So you can see why this is a good physiology question, even without necessarily knowing norepinephrine and its sympathomimetic effects. You can pair up the correct physiologic functions and even come to answer choice E. So I think a good physiology question here.
Excellent. Thank you, Parvs. Great job, everyone. That was a tough question. Let's go ahead and move on now to our second question on cardiac physiology. Once again, the answer choices are covered up. That is by design, and we will begin with the lead-in. The opening of the valve involved in this patient's heart murmur best corresponds to which letter on this pressure volume loop? The opening of the valve involved in this patient's heart murmur best corresponds to which letter on this pressure volume loop? I'll give all of you a few moments here to let us know in the question box how many steps you believe this question will require, and then we'll read the vignette. I see some responses coming in, so let's go ahead and read that vignette. A 38-year-old woman comes to the emergency department because of increasing shortness of breath and fever. She has a history of injectable drug use. Temperature is 39.2 Celsius or 102.6 Fahrenheit. Physical examination reveals pulmonary crackles. Cardiac auscultation reveals a holosystolic murmur, obscuring the first heart sound and best heard at the apex. The opening of the valve involved in this patient's heart murmur best corresponds to which letter on this pressure volume loop? I'll give all of you a few moments to start thinking about what's important in a lead-in and vignette as I hand it off to Paris.
Thank you, Sean. So once again, we will go ahead and walk you through what we think are the important clues in this vignette and the lead-in, okay? So now, this question is actually, as you read that lead-in first, it actually is a little bit important to pick up on what's going on in this question because they're asking us specifically about the valve in this patient, okay? So 38-year-old woman, again, demographics, important to take note of. Why did she come to the ER? Increasing shortness of breath and fever, okay? Don't forget why they came to the ER or the clinic in the first place. They then give us some important social history about injectable drug use. They give us some physical exam findings, some vital signs, and then some important cardiac exam findings. As we know, this is cardiac physiology, so it's going to be important to make note of those, especially when they're telling you that she has a murmur. And then when they tell you they have a murmur, a lot of times they may give you descriptions, kind of what they did here. And it's important to take those descriptions and not forget about it, because that will usually help clue you in as to what kind of murmur it is. So then let's take a look at this lead-in. They're asking about a nice long complex vignette here. So the opening of the valve involved in the patient's heart murmur best corresponds to which letter on the pressure volume loop. So I know our favorite pressure volume loop diagram right there at the bottom right. So how many steps is this question? Well, I think one, we need to figure out what kind of murmur does this patient have. So that's probably step number one. And then two, of that valve, when does it open and close, I guess, and in relation to what letter that is. So I think figuring out the valve and the murmur, and then knowing the opening of that valve murmur, where does that take place on that pressure volume loop? So I think you could argue this is a two-step question here. So let's go ahead and take a look at those answer choices, most likely looking specifically at A, B, C, D, E on that pressure volume loop. So make sure you get a good look at that pressure volume loop. Make sure you're getting a good idea of what you think is going on in this question, because we're going to go ahead and open up that poll. So go ahead and select the point that you think is the best answer in this question, and we'll talk about it in just a few seconds.
Excellent. So once again, we'll wait until about 2/3 of you have responded. Then we'll go over the correct and incorrect answer choices. Once again, as always, we do have a raffle at the end of the evening, and you must be present to win, so make sure you stick around. We also have a special offer for all of you in attendance. And a friendly reminder that next week's topic is step 2. I see the responses coming in. We'll give all of you a few more moments here. All right, I see that 2/3 of you have responded. Let's go ahead and close the poll and see what the audience selected. It looks like 46% of you selected answer choice A, and in second place was answer choice B, with 22% of you selecting B. So let's go ahead and take a look and see what the correct answer is. And the correct answer is A, and 46% of you got it right. So well done. It was a challenging question, but almost half of you got it right. So great job. But let's make sure you got it right for the right reasons and understand the incorrect responses as well. And Forrest is going to explain it to us now. Forrest.
Thank you, Sean. So yes, great job, guys. So this is a nice classic cardiac physiology question, looking at that pressure volume loop. So what's going on in this patient? Well, this patient has a new heart murmur. We know a few things. There's a fever, there's a history of drug use, and specifically injectable drug use. So this is likely suggesting infective endocarditis, okay? Now, patients with infective endocarditis who are injectable drug users, actually more commonly, the right-sided heart valves are affected more than the left-sided heart valves, almost in a 2-to-1 ratio, okay? So you could think about tricuspid regurgitation here. It's actually the most common murmur in this setting. However, the mitral valve is also affected, okay? And for those of you who got this question wrong, this may be kind of the first step that we made a misstep on. So why is this more mitral valve? Well, it's a holosystolic murmur, okay? It obscures the first heart sound, and it's best heard at the apex, okay? So these are all signs pointing to a mitral valve murmur rather than a tricuspid valve murmur, okay? So of those options, then the best answer choice would be mitral valve murmur, okay? So we know it's a holosystolic murmur. It obscures the first heart sound, so then we can go to mitral regurgitation, okay? So in mitral regurgitation, eventually you have increased left atrial volume and pressure, and this leads to a backup of fluid that then causes pulmonary edema and dyspnea. So the other sign that points to this being a mitral valve pathology and not a tricuspid valve pathology is the pulmonary crackles they told us about on the physical exam. So you can see why highlighting that was important, okay? Now, talking about the mitral valve, so the pressure volume loop, that demonstrates the relationship between left ventricle pressure and volume during both systole and diastole. So we have determined now that this is the mitral valve. And actually on the next slide, Sean has gone ahead and pulled up a nice diagram corresponding to the various points of the pressure volume loop. This question was asking about the opening of the valve affected. You can see there the mitral valve opens at that point that is the bottom left, okay? The point that was marked as point B is when the mitral valve closes. That's the bottom right. The point that was demarcated as point C, that's when the AV node, or sorry, the AV opens, okay? And then you can see there, point E was actually ventricular ejection. That's right at the top. And then point D was the top left when AV closes, okay? So going back to our question, you can see now that the mitral valve opens at point A, the bottom left. So hopefully you guys can figure out that that is what they were getting at in this question. We kind of talked about what the other answer choices were getting at. Point E, now looking at this again, that is ventricular ejection. Point D, that is aortic valve closure. Point C, that is aortic valve opening. Point B is mitral valve closure. So I think the main things here are, one, picking up what murmur is going on, and then two, knowing that where it corresponds to on the pressure volume loop. So another nice cardiac physiology question, and great job on this question.
Excellent, thank you, Paris. So we're 2 questions in, we've got 2 to go, but before we get to our third question, I want to tell you briefly about RX Coach. So you've met Boris, you've met Brian, you've met some of our other coaches in the past. And what our coaches do is they work with you individually. So it's you and a coach one-on-one, working towards your academic goals, whether it be studying for med school exams, planning on how to study while you're in school, whether it's studying for a comprehensive exam, whether it's studying for step 1, step 2, or COMLEX, we're here to help. If you're studying for a board exam, the first thing we'll do is we'll administer one of our 160 question assessments. Once you take the assessment, we will then create a personalized study plan based on those strengths and weaknesses. And then you'll meet with your tutor regularly to implement that study plan and also to ask questions, to have concepts explained to you, as well as do practice questions together like we're doing today. And as we get to work with you, we start to get to know you, and we can identify your knowledge gaps and bridge them. We can see if you have any areas of weakness when it comes to content. We can also work with you to master those test-taking skills, which is going to be very important. If you want to succeed and get a high score, you need to have the knowledge foundation, but you also need to have good test-taking skills. And working with somebody one-on-one really helps you do that. A lot of USMLE programs out there, you know, everybody does the same thing at the same time. Unfortunately, that doesn't work for everybody because we're all different people. We learn differently. We have different strengths, different weaknesses. We learn at different paces. And most USMLE programs also do not take test taking into consideration. Now, we have a lot of experience. We've been doing this for 30 years. We have data to back it up, and we've created our own assessments. We've created BRICS, which includes, we've created RX360, which includes BRICS. It includes our Express videos, our flashbacks, of course, and our question bank, which you'll all get access to as part of the coaching service. So as opposed to many other companies out there, we've actually been in medical education prior to starting tutoring, and we have the experience and the expertise to really help you succeed. So if you're interested in utilizing the help of one of our experienced and certified coaches, reach out to us at rx-coach or rx-coach.com so that we can talk about the program and how it can benefit you. And you can simply visit that website and click on that free consultation tab to have that conversation. And we're more than happy to talk to you about the program and how you can benefit from working with one of our RX coaches. So with that being said, let's go ahead and move on to our third question of the evening. Once again, the answer choices are covered up, and we will begin with the lead-in. Which of the labeled cardiac structures is most likely enlarged in this patient? Which of the labeled cardiac structures is most likely enlarged in this patient? I'll give all of you a few moments here to let us know in the question box how many steps you believe this question will require before we move on to the lead-in. All right, I see the responses coming in. Let's go ahead and take a look at the vignette. A 63-year-old man comes to the emergency department with acute substernal chest pain and shortness of breath that awakened him from sleep. Pulse is 120 per minute. Respirations are 22 per minute. Blood pressure is 111/70. And oxygen saturation is 88% on room air. Lung auscultation reveals bilateral pulmonary crackles and a systolic murmur that obscures the first heart sound. An echocardiogram from a healthy heart is shown. which of the labeled cardiac structures is most likely enlarged in this patient? Once again, please start thinking about the important clues in the vignette and lead-in as I hand it off to Paris.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. So demographics, again, an elderly patient, a 63-year-old man. Why did he come to the ER? Well, he had acute substernal chest pain and shortness of breath, and awakened him from his sleep. They give us some important cardiac vital signs, some physical exam findings, and then they give us an echo, and they're saying that it's actually the echo of a healthy heart, but it's a labeled diagram. Then they're asking us which of those labeled structures is most likely enlarged in this patient. So I think one, I don't want to talk too much without giving this away, but I'll say how many steps is this question? I think one, we need to figure out exactly what is going on in this patient. Two, which structure could maybe be enlarged as a result of what's going on in this patient. So at least a two-step question, maybe 3 steps depending on the pathophysiology. So probably at least 2 steps. So let's go ahead and take a look at the answer choices. You can see it's probably looking specifically at A, B, C, D, and E. Okay. So make sure you get a good look at that echocardiogram. Figure out what you think is going on in this question and which of those structures is most likely enlarged in this patient, and we'll talk about it in just a few seconds.
Excellent. So we're going to go ahead and open up that poll for you and give you a moment to select your answer. All right, I see the responses coming in. We're going to wait until 2/3 of you have responded before we move on to the explanations and uncover the correct answer choice. We have one more question after this on cardiac physiology, and then we'll do our raffle and our special offer. Once again, next week's topic is step 2, so make sure you tune in Tuesday at 8 p.m. for our step 2 question lab. All right, I see that more than 2/3 of you have responded, so we're going to go ahead and close that poll and see what all of you selected. And it looks like 39% of you selected answer choice B, and 30% of you selected answer choice C. So let's go ahead and take a look and see what the correct answer is. And the correct answer is C, and 30% of you selected answer choice C. So definitely a challenging question. I'm going to hand it off to Paris so we can all learn from him and master this topic. Paris.
Thank you, Sean. Yeah, definitely a tough question, but one that nicely utilizes a multimedia image here. So what's going on in this question? So remember how I told you it's important to take note of why the patient came to the ER, to the clinic, to the hospital? So this patient came with acute substernal chest pain and shortness of breath. So maybe, you weren't sure exactly what kind of murmur was going on, but if you looked at why the patient was coming, acute substernal chest pain, that really should make you think about an acute myocardial infarction or acute MI, okay? So this patient likely is having an acute MI. That's why they came in. We're then being told about additional signs and symptoms, but probably what happened first is the MI, okay? So what about those respiratory signs? What about that murmur? How did that then develop? Well, he probably developed acute mitral regurgitation from the MI. Okay, so the acute MI, he probably had some infarction of the ventricle, and that caused impairment of the papillary muscles. And we know those are attached to the leaflet, so the mitral valve isn't closing properly, and that's because of the MI, okay? So there's probably an issue with the mitral valve closing properly, and that's going to lead to an acute mitral regurgitation. So what then happens? Well, during ventricular systole, blood is going to leak back into that left atrium, okay? So the left atrium volume and pressure are going to increase, and that's going to lead to some backup and cause pulmonary edema, and we're seeing that with bilateral pulmonary crackles, okay? Eventually, over time, that increased volume and pressure in the left atrium can lead to enlargement of the left atrium. So when they're asking what's most likely enlarged, I think it's probably the left atrium. And I forgot to mention this. I think another step, that makes us another step is not just knowing that the structure that is enlarged, but then being able to look at this echo and figure out which structure that is. Okay, so that's probably a third step that I forgot to mention. So what are these structures? Well, echocardiograms, if you're not too familiar, they can be a little difficult to interpret because they seem a little upside down and backwards, okay? So let's see what we can do to find the left atrium, okay? So we do know that the ventricles are usually here, in this case, at the top of the figure. And the reason we can say that is because letter E is kind of pointing at the apex or the narrowing of the heart, okay? And obviously, in general, the ventricles are a little bit bigger than the atria. And keeping in mind, this echo is that from a healthy heart, okay? So E is pointing at the apex, which makes sense because B and A seem to be a little bit bigger than the letters below it, okay? So then we're trying to figure out which ventricle is which. Well, usually the left ventricle is bigger than the right ventricle. So that would mean that answer choice B is probably the left ventricle and answer choice A is probably the right ventricle. So then we can connect the dots. We see that valve connecting B and C. So that would mean that C is the left atrium, okay? So hopefully you can start to figure out how to use your clues and anatomy knowledge to interpret some of these radiologic images. So a nice question here. So that would mean answer choice A is the right ventricle, B is the left ventricle, C is the left atrium, as we mentioned, D is the right atrium, and E is the apex of the left ventricle. So a nice physiology question with a radiographic tie-in, and another tough question here as well.
Well, excellent, Boris. Thank you very much. Great job. I know that was a tough question, but you are going to have these tough questions on test day. And if for some reason you're sitting there thinking, oh, I should have known that, I could have gotten that right, or why did I miss it? These are all, questions that a lot of people ask themselves, but remember, RX Coach is here to help. And we do these question labs also every single week. So, rx-coach.com if you want to work with one of our experts and really master all these topics, which are very important and you will see on test day. All right, let's go ahead and move on now to our last question of the evening. Once again, the answer choices are covered up, and we will begin with the lead-in. Which of the following points on the graph best depicts the changed physiology following administration of the last drug the patient was most likely prescribed? And we have a note there that tells us that solid lines indicate normal on the graph. Which of the following points on the graph best depicts the changed physiology following administration of the last drug the patient was most likely prescribed? So I'll give all of you a few moments here to let us know how many steps you believe this question will require. And then we'll read the vignette. All right, I see the responses coming in. Let's go ahead and read the vignette. A 54-year-old man presents with shortness of breath and a racing heartbeat. He has a history of poorly controlled hypertension. ECG reveals an irregular heartbeat with a pulse of 140 to 150. After several drugs failed to adequately slow his heart rate, he is started on a drug that inhibits the myocardial sodium-potassium pump, which slows his heart rate to 100 per minute. Which of the following points on the graph best depicts the changed physiology following administration of the last drug the patient was most likely prescribed? I'll give all of you a few moments here to start thinking about the important clues in the vignette and lead-in as I hand it off to Paris.
Thank you, Sean. So we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. So we've now done this for 4 questions. So hopefully you guys are starting to get a sense of what we think are important to highlight and maybe what's not as important to highlight, so that when you go back and take a look at what you've highlighted, you know, you kind of are really saving your time and really only looking at what's important, okay? And you can see in our previous questions, there are some important clues that are important to highlight and could have led to the correct answer. So we're going to go ahead and do that again with this question. Again, demographics, a 54-year-old male. Why is he coming? Well, shortness of breath and a racing heartbeat, okay? They then give us some medical history, and it's always important to make note of the control of some of these chronic diseases. Is there hypertension or diabetes? Is it under good control? Is it under bad control, poorly controlled? They then give us some EKG findings, and then they tell us specifically, kind of getting at pharmacotherapy. So they're saying that several drugs have failed to slow his heart rate, so he's then started on a new drug, and they're telling us the mechanism of that drug. So then they are asking us in the lead-in, which point best depicts the changed physiology after that patient was most likely prescribed that last drug. So we need to figure out a few things here. How many steps is this question? 1, I think we need to figure out what is this drug that they're talking about based on the mechanism. And 2, what is the change in cardiac physiology that results from giving that drug? And then 3, what does that correspond to on that graph? So I think at least 3 steps here, okay? So let's go ahead and take a look at the answer choices. And as you can probably imagine, also another A, B, C, D, E answer choice question. So make sure you're taking a good look at this graph, the x-axis, the y-axis, the color of the curves. The solid lines indicate normal, the dotted lines are changes. Go ahead and think about what you think is going on, which one is most likely to be the answer in this question, and we'll talk about it in just a few seconds.
All right, so this is our last question of the evening. Let's try to finish strong. Once again, we'll wait until about 2/3 of you have responded, and then once we do our explanations for this question, we will do our raffle and unveil our special offer. I see the responses coming in. Reminder once again that next week's topic is step 2, so we hope to see you all here. We hope that you will also tell your friends to join us as well. All right, I see that 2/3 of you have already responded. Let's go ahead and close that poll and see what all of you selected. And it was close. In first place by 1 percentage point was answer choice A, and then we're tied with 25% of you selecting answer choice B as well as D. So a challenging question indeed. Let's take a look and see what the correct answer is. And the correct answer is B, and 25% of you got it right. So definitely a challenging question, but these graphs are high yield and you must know how to understand and interpret them. So let's go ahead and hand it off to Paris who can explain it to us. Paris.
Thank you, Sean. Yeah, definitely a tough question. And, you know, this graph often gives students a lot of issues. So let's see if we can help clarify it a little bit, okay? So this patient's got an irregular heartbeat with an elevated heart rate. Patient also has some palpitations and dyspnea. So this really is getting at likely atrial fibrillation, okay? Now we know some of the classic drugs for atrial fibrillation are beta blockers, calcium channel blockers, but it sounds like these drugs didn't really work. So then they started a drug that inhibits the myocardial sodium-potassium pump. This is getting at digoxin. So hopefully you guys were able to pick that up, okay? Digoxin inhibits that sodium-potassium pump. So it secondarily allows for increased intracellular calcium, okay? So thus, digoxin increases cardiac contractility, which will thus increase cardiac output, okay? Let's go ahead and take a look at the next slide. Sean has gone ahead and pulled up a table looking specifically at the description of this curves and the various changes that are laid out nicely in first aid, okay? So you can see here, again, solid lines indicate normal, okay? Any change in inotropy should only affect the cardiac function curve, not the vascular function curve, okay? So, and you can see there under at the bottom of that row, increased inotropy or changes in contractility. An example of that would increase inotropy, catecholamines, dobutamine, and as you can see there, digoxin. So these all increase contractility or inotropy, okay? So you can see that that increased inotropy causes a leftward upward shift of that cardiac function curve. Oppositely, and decreased in inotropy, such as heart failure with reduced EF, that would lead to a downward rightward shift of that cardiac function curve, okay? You can see there that the vascular function curve actually stays the same in this patient, okay? We're not really doing anything to increase venous return, okay? We're not giving any fluids. This patient isn't hemorrhaging out where they would be losing intravascular volume. So in this patient, this would stay the same. So if we go back to our question in our graphic they provided us, answer choice B, you can see there now, is the best answer because that red curve is increasing upward. So you do have an increase in contractility, but answer choice B is along the same blue line. There's no change in venous return. Answer choice A is saying there is an increase in inotropy, but it's also saying there's a change in venous return, okay? Which is not the case here. Answer choice C, that's just normal cardiac output, normal venous return, so that's not the best answer here. Answer choice D, as you can see there, that actually is along the same venous return line, okay? However, that is getting at decreased inotropy, okay? So heart failure with a reduced ejection fraction is a good example of that. And you can see that red dotted line that D sits on is lower than the normal solid red line. Answer choice E is wrong for a couple of reasons. One, because it's saying there is decreased cardiac output or contractility, and there is also a change in venous return, which we know is not the case because we're just talking about inotropy with digoxin. So hopefully you guys were able to better understand this tough graphic through this question. Great job overall today, guys, and I will hand it back to Sean.